In this demo, I will be going over CKB Boost, which is the web-based application of CKB. And so you have access to all of the content with a subscription. So when you first log into CKB Boost, you're going to end up on the home page. The home page includes some basic searches, so you can explore by gene, variant, drug class, drug, and tumor type. And then there's a couple advanced searches as well, where you can look for specific data elements to a clinical trial as well as evidence. To bring your attention to the top here, I'm going to go to what's called genes. This is our gene grid. In CKB, we have just over 2,200 genes curated, and you can see all of those genes in this gene grid. And then you can search for them alphabetically. And if you clicked on any of these buttons, it'll bring you directly to the gene detail page. The next tab over is the drug classes. Drug classes are also in a grid, and these drug classes are arranged alphabetically. When we curate drugs in CKB, we group them, typically we'll group them within a drug class. And so drug classes are named based on what they target. For example, drug class AKT1 inhibitor would include drugs that are targeting AKT1. And the number badge here indicates how many drugs are within that drug class. Again, if you were to click on any of these drug classes, it would bring you directly to the drug class detail page, and then you'll find information about the drugs, the drug descriptions, synonyms, etc. The About section here shows you the data model, so you can see the different data elements within CKB and how they're related. So CKB is a relational database, and you can see how genes are related to variants, and then variants are related to molecular profile. I'll go over molecular profile as I go through that searches, but just briefly, molecular profile acts sort of as a container where you can group one or more variants together and then link that molecular profile to what's called efficacy evidence and then also clinical trials. And then, of course, efficacy evidence and clinical trials include indications. And then down below includes the therapy, which would be linked to evidence and clinical trials. And then, of course, I just mentioned drug class. And then within drug classes and therapies is the drug. In this drop down right here, the help section, there's some information about category variants, which I'll go over in a little bit. But there is a downloadable PDF with additional information about those. There's also some contact information if you need to reach us at ckbsupport at genomenon.com. Curation methodology. So we want to be very transparent in terms of how we curate our content. So you'll find some decision matrices there. There's also a downloadable FAQ, a glossary of terms, navigation legend, and then finally a downloadable tutorial with screenshots within the application, pointing out different elements of the pages. To get back to the home page, you can click on the top left here where it says CKB Boost. So to best demonstrate how you can search for content and actionable insights in CKB, I'm going to first explore by gene. So within CKB, when we curate genes, we follow HGNC nomenclature. So you'd start typing in the gene symbol. I'm going to go to the gene kit. Once that comes up in the dropdown, you can then hit submit, and that'll bring you to the gene detail page. On the gene detail page on the top left, you'll see the gene symbol, the synonyms, and the gene description. So our gene descriptions consist of two sentences. The first sentence being what is the function of the protein encoded by that gene, so what is its normal function? And then the second sentence being its relationship to cancer. So are there different types of mutations within specific tumor types for this particular gene? And you can see that everything is referenced. So if you need more information, these are hyperlinked, and so you can go directly to the paper within PubMed. Below the gene description, you'll see the NCBI gene ID, the chromosome and map location, and the canonical transcript that we're using. You'll also see whether or not it is main select, and then finally the gene role. The gene role could be, of course, oncogene, tumor suppressor, both or unknown, and this is the reference used to support that. To the right, we have some visuals in CKB Boost that some that you don't see actually in our free version of CKB Core. The first one being the variant Navigator. So the variant navigator is a great way to look for variants within the protein across different domains, regions, or exons. And so if I click on Explore Variant Navigator, that'll bring me to the Variant Navigator page. And here you can see, as mentioned, different tracks, including domain, region, topological domain, transmembrane, exon. And you can see all these various lollipops. These represent the different variants and the location of the variants within the protein at the specific codon. And if you hover over these little pie charts, it'll actually show you the different variants that are curated in CKB. And these are actually based on impact. So whether or not the variant is a deletion, an indel, insertion, etc. And you can see that legend on the right-hand side. You can also switch over to protein effect if you would like to look at variants based on their protein effect. So variants in CKB can be curated based on functional characterization within the literature. So this could include a variant that results in a gain of function, a loss of function, it could be no effect, or it could be unknown. And so again, if you hover over these, you can see what variants fall at that position. You can also zoom in particular regions. For instance, if you wanted to only focus on variants within the protein kinase domain, you can click and drag, and that will zoom in on the specific region. And then down below, you'll see the table of variants. So these variants down below are what are the variants that are showing up in the graph above. To get back to the entire protein, you can just hit reset zoom, and that will bring back all of the variants. You can also change the tracks. You can turn them off or on. So if you didn't want to look at domains, you could click that, and so on for the others as well. All right, I'm going to go back to the gene detail page. So in addition to the variant navigator, we also have just a couple donut plots based on variant impact. So you can sort of see the landscape of the variants based on impact, and then as well as protein effect. Now I'm going to go down to the 5 tabs below the gene description. The first tab includes the gene variants. So these are the variants curated to KIT. That's the page we're on. And you can see in the table below, in the first column, the variant. CKB is protein-centric, so you're going to come in searching at the protein level for these types of variants. The next column will be the impact, whether it's missense, nonsense, etc. And then the protein effect. So I mentioned earlier protein effect when we were looking at the variant navigator. So this is where you're going to see if it's the variant is characterized as a loss of function, gain of function. And this is, what's part of our control vocabulary, which we use frequently in CKB. And so you can see, again, variants that are unknown, you could filter down. Say you only wanted to look at variants that result in a gain of function, you can filter within that column. So all the columns are filterable and sortable. In the next column is the variant description. The variant description in CKB typically consists of 2 sentences for a variant. The first sentence indicates the location of the variant within the protein, while the second sentence indicates whether or not it's been biochemically characterized within the literature. If it has not been characterized within the literature, it will have a protein effect of unknown. And you can see in this example here with T22A, this variant has a month and year at the end of the second sentence. So this indicates the last time that variant was searched within the literature. Following our SOP, we do update our variants of unknown significance every 12 months. In addition, you might see some PMIDs in the variants of unknown significance. If we happen to find the variant within a sequencing study, perhaps it's in a supplemental table, you can find that information there. The last column here is associated with drug resistance. So this is a great way to quickly see if there are any variants within the gene that have been associated with drug resistance. So if I type in a Y here, it will bring up all the variants that have been associated with resistance, and that'll be indicated in the second sentence of the variant description. And so you can see here, this particular deletion insertion is associated with resistance to KIT inhibitors, and then the reference to support that. If you needed more information, you can go directly to the paper, or you can go to the actual evidence. So there would be evidence associating this variant with resistance. The second tab is category variants. So in CKB, when we curate evidence, clinical trials, guidelines, we want to stay true to what is being presented in those or implicated. And so we have this concept of category variants because often those biomarkers are going to be general categories. And these could be functional or positional. So your functional category variants would be act mute or inact mute. And then your positional category variants might be at the exon level or at the codon level. And so when we have these category variants linked to actual evidence, these categories can also act as parent categories to specific variants. So when we curate a specific variant, it can become a member of one of these categories. And I'll show you in a little bit how you can leverage these category variants to look at what's called extended evidence and identify sort of mostly high-level treatment options. This fourth tab here is evidence, so efficacy evidence. This is really the bread and butter of CKB. This is where we link a molecular profile, which, as I mentioned earlier, sort of acts as a container, so it contains one or more variants, to a tumor type, a therapy, and a response. And all of that is summarized in what we call the efficacy evidence annotation. So we're going to the paper, we're looking at the study, we're reviewing it, looking, especially if it's clinical trials, we're looking to see what the primary and secondary endpoint results are, and we're including that information in the annotation. So that really allows a user to come in and quickly assess different types of evidence and see what one may be more appropriate for their case. In addition to these first four columns, we also include the approval status. So the approval status is sort of where you can see that level of evidence. So it could be FDA approved, so your higher level evidence. Guidelines, we do curate guidelines from NCCN as well as ESMO. For the NCCN guidelines, we actually check those monthly, both heme and solid tumor. So we'll update any changes that occur for those guidelines. Below that, you'll see phase 3 to phase 1 clinical trial data, so papers or studies that are published. And then from there, there could be clinical studies. I'm going to scroll up and just filter down, but there could be case reports, case series. There could also be preclinical evidence. Preclinical evidence is then separated out by different types. So it could be patient-derived xenograft models. It could be based on cell culture, cell line xenograft models, patient-derived cells, so that you can easily filter down to what you want. The next tab over is the evidence tab. So there is different types of evidence in CKB, with the majority being actionable. However, we also include diagnostic evidence, prognostic evidence, risk factor, and emerging. For the diagnostic and prognostic evidence, we do have very stringent criteria when curating that type of evidence. So most of the time, you're going to see that type of evidence at the higher level, specifically for guidelines. In terms of the response type, so I'm jumping back over to this third column here, I mentioned again that we use a lot of controlled vocabulary in CKB, and this is another area. So response for evidence could be linked to sensitive. It could be predicted sensitive. If it's a case report, we're going to call that predicted sensitive, just because the sample size, of course, is small. But it could also be resistant, predicted resistant, no benefit, not predictive. So there's a lot of different types that you could filter down to, depending on what you're interested in. For the therapy name, as I mentioned earlier, sort of acts as a container similar to molecular profile. So if it's a single drug, you would include that. But if it's also a combination of drugs for the therapy, you would include all of them. Jumping back over to these last columns here, evidence level and inferred tier. So for evidence level and inferred tier, we are referring to this note up here. So this is based on the AMP CAP ASCO evidence levels. And so these are actually assigned at the level of the efficacy evidence. So you can see here your higher level evidence with the approval status of FDA approved corresponding to evidence level A, same with guidelines, and then the corresponding tier. And this goes down from A to B to C to D. All right. Now I'm going to jump over to this last tab, which is clinical trials. So we curate clinical trials weekly within CKB. And so when we curate trials, we're curating information related to the phase of the trial, the therapies, the title, the recruitment status, also covered countries. So we're currently covering 39 countries. And if there are any countries we're not covering, that'll be indicated in this last column here. The recruitment status in CKB Boost is updated daily, so you can look and filter down to certain trials if you want. So I'm going to just type in recruiting here. And I will jump into one of these trials just to give you an idea of what that looks like. And so if I click on this clinical trial ID, you can see all that clinical trial detail. You can actually link right out to the clinical trial in clinicaltrials.gov by clicking on this hyperlink. But then you can see all the additional information here in addition to the covered country. And down below is the variant requirements. So when we curate clinical trials, we are curating and looking at the inclusion-exclusion criteria, trying to capture, the different types of variants that would be required for that trial. And those variant requirements include obviously the molecular profile and then a requirement type. So again, using control vocabulary in CKB, the requirement type could be partial required. Perhaps it depends on a therapeutic arm, or it could be partial excluded, it could be allowed, diagnostic. So there's a lot of different ways you can interpret those variant requirements as needed. And then the next tab over are the locations. So this will indicate the location of the trial, depending on, of course, the different countries, the cities. And this information is pulled in through clinicaltrials.gov. So if that information is not available in clinicaltrials.gov, it actually will not be available here as well. You can click on this details button if you wanted some more information. Perhaps you wanted to be able to contact somebody at the trial to ask questions. Sometimes that information will be in clinicaltrials.gov, but you can easily also find it in CKB if it is there. All right, I'm going to go back to the home page. So we went through the gene detail page, and now I'm going to show you how to explore by variant. So if I click on Explore by Variant, you would start typing in your variant that you're looking for. We do follow HGBS nomenclature, so I'm going to stick with the same gene and go with KIT. Start typing in my variant. Once I find it, I'm going to select it, click Submit, and that will bring me to the gene variant detail page. So on the gene variant detail page, you'll see the variant, the impact, the protein effect, and the variant description, similar to the information that you saw on the gene detail page in that variant tab. Below that, though, you'll also see some information about whether or not the variant is transforming, is it associated with drug resistance, is it a known polymorphism, and is it a hotspot? If it were a hotspot, it would be indicated there, and that's based on cancerhotspots.org. Below this table, you'll see category variant paths. So I talked about the category variants earlier and from that second tab on the gene detail page. And this is where these category variant relationships really come into play. So you want to find information about this specific variant. We can see that this variant is predicted to result in a gain of function. And we see that it belongs to a category for KIT exon 11 deletion. And then those are actually considered to be activating mutations. So it falls under KIT act mut. So this would be your functional path. If we look at the path below, it falls in KIT exon 11 deletion, which is a member of KIT exon 11. So this would be considered your positional path. Down below, we can look for the actual evidence that would be associated with this variant. So in the first tab, it indicates variant evidence. So that would indicate evidence that is specific to this variant. Currently, there is no evidence within the literature for this variant. In the second tab, we have complex molecular profile evidence. So this would indicate any evidence that's linked to a molecular profile that contains this variant as well as an additional genomic alteration. And so this could be any type of alteration. We include a lot of different types of variants within CKB, in addition to expression, amplification, deletion, positive. So there's a lot of different ways you can look for complex molecular profiles. The third tab, extended evidence, is where you're going to see the evidence related to the parent categories that the variant is a member of. And so if we look below here, we can see ACT mute, variant ACT mute is up here in that functional path. If we scroll down a little, we see KIT exon 11, also in the positional path in this case. And so this is where you're likely going to see your higher level evidence. So these are related to guidelines. And so in this case, you would have the option of looking at evidence related to various drugs, including nilotinib, ripretinib, dasatinib, etc. And then you could also filter down to specific tumor types if you wanted. So there's a lot of ways, again, that you can look for potential treatment options. The last tab here is associated with clinical trials. This tab would indicate whether or not the variant is listed as a variant requirement in a clinical trial. In this case, the specific variant is not. Just to bring your attention to the top right here, so we do include the variant reference transcript, so you can see the gDNA, cDNA, the source database, which is RefSeq, and then the genome build that we use, which is HG38. There's also a tab for other transcripts as well, and you can see that information there if you needed any other information on transcripts. I'm going to now show you another really great visual in CKB Boost. So this is called our Sunburst plots. So if I click on Explore Visually, this will bring me to a new page with our Sunburst plots. So this is another way to visualize and see those category variant relationships that exist among the variants within a gene. So here we have the gene kit. All of our genes have one of these sunburst plots, and you can see the different relationships based on positional relationships, functional. So you can see that ACT mute there, and you can see all the variants underneath ACT mute as you hover over them. And then under exon 11 deletion, the same. If you click on exon 11 deletion there, the sunburst will readjust. And now you can see in more detail those member variants. If you scroll below, you can see some additional content. So this is all content related to what's visible in the sunburst plot. So I can see all the evidence for KIT exon 11 deletion if I scroll below, the extended evidence. So on the right here, you can see those category variant paths for KIT exon 11 deletion. I can see all the different molecular profiles that KIT exon 11 deletion belongs to. And then finally, the member variants. So this is a great place to look to see what are all the different variants that fall within KIT exon 11 deletion. I'm going to go back to the home page. I'll just quickly go over the advanced search and how that looks for both clinical trials and evidence. So if I click on clinical trial here, you can see multiple ways to add or input what you're looking for. So if you want, a specific variant, you could try that. You could use a general category variant. You can specify a drug for a trial. If you are, have an interest in a specific one, tumor type. So I could type in here, if I wanted lung adenocarcinoma, I would start typing it in and then look for it within the ontology tree. So when we curate tumor types within CKB related to evidence in clinical trials, we utilize the disease ontology terms. So I could select that. I can also include child terms that fall under lung adenocarcinoma. I can specify a phase for the trial. So maybe I only want to look at phase 3 trials, and I could also specify a country. So as I mentioned, we cover 39 countries, and you can actually see all of those countries listed up here, and then they'll be available in the drop down as well. And then if you were looking within the US, you could also specify state, and within Canada, you could specify the province. If I click submit, that'll bring me to the advanced clinical trial search results page. And here you'll see information related to clinical trials that are directly associated with the data that you input. And so those are all listed below. All right. And then very similar would be the advanced evidence search. With the advanced evidence search, you can look for a specific molecular profile, again, tumor type, drug. Maybe you only want to look at evidence that is considered sensitive or maybe resistant. You can also specify the evidence type. So you could choose perhaps just prognostic evidence. And then once you hit submit, it'll bring you to an advanced evidence search results page. There is a video tutorial that goes into more detail on the advanced searches, which you can find at genomenon.com under resources. All right, and with that, I'm going to close out this demo. But if you have any questions, you can always reach out to us, as I mentioned, at ckbsupport@genomenon.com. You can also, if you want us to curate content, perhaps there's a variant you're looking for and it's not in CKB, you can reach out to us through that button, request content. Thank you for taking the time to watch this overview of CKB Boost. To learn more about the CKB Boost offering, as well as our other CKB offerings, Core and Flex, please visit ckbhome.genomenon.com.